First, and probably the most important one that we want to talk about is highlighting the importance of prevention. In terms of prevention, there are a few things that we're recommending. One of the things relates to mosquito-borne countries, specifically the Zika virus mosquito is the Aedes aegypti, very prevalent in South America, Central America, and the Caribbean. So obviously if we have patients that have traveled to areas or will travel to areas that have high incidence of cases and the mosquito, and they're going to get exposed. And folks that live here in South Florida should take the needed preventative measures that include repellent use, mosquito nets, and try to avoid puddling water because that actually allows the multiplication of the mosquito. So the prevention is very important. Diagnosis, we should be talking about how to early identify patients that might have signs and symptoms in the diagnosis. Zika is a viral illness like a lot of different viruses. It presents with a combination of different signs and symptoms, which include fever, headache, eye injections or conjunctivitis, muscle aches, and a rash. The signs and symptoms of Zika are very similar to other mosquito-borne illnesses like dengue and chikungunya. So, but fortunately, only 1 out of 5 patients that actually have the Zika virus will present the concerning signs and symptoms, and only a handful of those will actually be sick enough to need emergency care. But I think the diagnosis is important. Patients need to be aware of the signs and symptoms, and after they feel they have or suspect that they have Zika virus, what we recommend is for them to approach their local doctor, urgent care centers, emergency departments, and get cared for. The diagnosis of any patient is basically the same. So signs and symptoms like we explained, rash, fever, headache, body aches. And the protocol involves identifying these patients and then notifying the Department of Health authorities, getting urine or blood samples to test specifically for Zika and other conditions that we might be considering as part of the differential diagnosis, and sending the test to the local labs here in the state of Florida. The difference between pregnant and non-pregnant patients, the approach is the same. The risk right now we're finding out that might be a little bit different because we're seeing a number of cases, a spike in cases associated with congenital abnormalities, specifically microcephaly or small heads in babies of patients, pregnant females that contracted the Zika virus, specifically in Brazil, Colombia, especially in Brazil. But the diagnosis treatment is the same, and we want to highlight prevention. We want to highlight preventative strategies and try to avoid contracting the disease. And from a personal standpoint, one of the things we want to highlight and recommend is if you're pregnant, try to avoid traveling to high peak areas for Zika virus because that obviously generates a potential risk. So what's fortunate is that the treatment is supportive. What we do is that you want to, there are 2 kinds of patients. Patients are going to be slightly symptomatic and patients are going to be very symptomatic. Any kind of infectious disease, depending on your body, your condition, your immune system, you can have from a very subtle response to a very aggressive response. For the majority of patients, are going to be asymptomatic. For the majority of patients that are symptomatic, the treatment is supportive, which involves hydration and fever control and symptomatic care. Water and Tylenol. Try to avoid aspirin because there is a complication associated with aspirin use called Reyes syndrome that you don't want. It's not specific to Zika. It's actually a condition that you get in various infectious conditions and the use of aspirin. But what we're recommending is water and Tylenol for sure. And obviously, if you're significantly sick, faint, feeling what we call toxic, feeling very ill, then there might be a possibility of admission to the hospital for further care.